My name is AFleming, and this presentation is for class HED 525. This presentation will be an overview of Chapter 5 in the textbook, Gender and the Social Construction of Illness by Judith Lorber and Lisa Jean Moore. The title of the chapter is If a Situation is Defined as Real, Premenstrual Syndrome and Menopause. In the introduction of the chapter, the author states that according to the Western culture in the 20th century, the menstrual cycle was transformed from a misunderstanding phenomenon of biomedical events. We learn from the biologically informed perspective that most women who are not pregnant do menstruate. When a female's body stops secreting pregnancy-preparing hormones that thicken the lining of the uterus, menopause occurs. This is due to the lining of the uterus not needing to be shed when fertilization of the ovum does not take place, as it was done through the menstrual cycle. Problems that can arise during menopause that can become a medical issue are pain, discomfort, and emotional reactions. Typical solutions for problems during menopause are prescription for hormones, stress management, and nutritional supplements. However, these solutions, such as prescriptions for hormones, can have negative side effects. The menstrual cycle can be different for different women, meaning the menstrual cycle can vary when they occur, how long it can last, and what emotional effects it can have on women. Through biomedical research, the time of the first period, length of time between cycles, how long the cycle lasts, the amount of flow during the cycle, and emotional effects are studied. According to the textbook, a social perspective that encourages girls and women to seek medical help for all menstrual problems contaminates the status of womanhood. According to Western folklores, menstruating women are impure and contaminating. However, from the scientific view of the 19th century, such ideas implicated by Western folklores were replaced by the ideas that monthly periods were a necessity to women's health. From a feminist viewpoint presented by Margie Prophet in 1993 article in the Quarterly Review of Biology, she stated that the function of menstruation is to defend against pathogens transported to the uterus by sperm. Emily Martin believes that research done on the monthly inefficiency and unreliability of women workers was to keep women out of the workplace during the times such as the Depression era. In 1978, Gloria Steinem asked what would happen if suddenly men could menstruate and women could not. The answer would be clear, she stated. Menstruation would become an inevitable, boast-worthy masculine event. Under the subheading of ritual menstruation in the textbook, it is stated that non-Western cultural models have a more positive viewpoint of menstruation. In 1991, Chris Knight developed a theory that links menstruation and the beginning of culture in prehistoric times. Knight used some of the findings of Martha McClintock, who stated that women who live together often menstruate at the same time. Knight argued that since women of the tribe worked together, they could ovulate and menstruate at the same time. The women would then refuse to have sexual relations with the men in the tribe, yet sending them away to hunt for food. Due to premenstrual syndrome, which is also known as PMS symptoms, women can sometimes be labeled as out of control around the time of their menstruation. Women can sometimes exhibit mood swings, aggressiveness, anger, and even violence a week or so before menstruation. With menopause, women can suffer from hot flashes, insomnia, and night sweats. Most research today about premenstrual syndrome follows a biomedical model. The biomedical model defines PMS as a syndrome with a hormonal cause within an individual. The medical focus has been on psychology aspects called premenstrual dysphoric disorder in the American Psychiatric Association's Diagnostic Manual. The pharmaceutical industry has launched several multimedia campaigns claiming that PMDD is a more severe form of PMS. PMDD has been cited as a psychiatric diagnosis with pharmaceutical treatments. According to one study that was cited in the textbook, PMDD affects 5% of menstruating women. Emotional states most commonly associated with PMS are tension, anxiety, depression, irritability, and hostility. Western culture has placed a negative mark on menopause as a sign of aging and the end of childbearing capabilities. However, Peruvian women gain full adulthood when menopause occurs. Peruvian women reap social and financial benefits and freedom from daily chores for large extended families. In the 1960s, hormone replacement therapy became popular as a cure to psychological effects of menopause. By the 1970s, the danger of endometrial cancer led to medical recommendations that estrogen, which is hormone replacement therapy, be used only for symptoms directly related to lower hormone levels. This influenced drug companies to develop a combination of estrogen and progesterone that was supposed to be safer, yet led to the possible increase in breast cancer incidence. Not only has HRT been helpful to women affected by menopause, but so has herbal remedies, dietary supplements, exercise, and yoga. As stated in the textbook, there are dangers of having PMS and menopause diagnosed as a medical condition. The first danger is that treatments can sometimes have bad side effects. Secondly, it objectifies women's bodies and procreative cycles. It also can oftentimes focus only on the negative aspects of PMS and menopause and label women in the workforce as unreliable workers.